The Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee Bazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me on tonight's Egg Whisperer Show. I'm super happy to be here. The topic of tonight's show is how to prevent infertility. Look, no one gets married, not that you need to be married to have a baby, and says, I cannot wait to have fertility issues and see Dr. Aimee. I don't want you to be my patient. I want you to learn about how to prevent infertility so that you can succeed and reach your family size goals and not have the heartbreak that so many of my patients have. But if you're going to have a problem, I want you to learn about it ahead of time. So this is why I'm doing tonight's show, to teach you how to prevent a lot of the common problems that I see in my day-to-day practice. At the end of the day, you cannot prevent infertility. Do you know why? Because inevitably, all of our eggs, the healthy ones, will run out. I just don't have a tool in my toolbox. I don't have some egg regenerating juice. I wish I did. I wish there was some sort of Botox that I can inject into my patients' ovaries so that they never run out of eggs and they freeze in time. So the reality is we all will have infertility because we all go through a normal aging process called menopause. And it's not a dirty word in my office. I talk about it. I talk about how it's so normal and it's just something that we have to accept. And so that's why I want to teach you about learning about your fertility, and ultimately how to prevent infertility. So step one is to go to an egg freezing party. You can sign up on my website, eggfreezingparty.com. That is a joke. I started Egg Freezing Party though in 2014 because I realized, and I kind of knew that for a long time, that there was a huge gap in fertility education and awareness. So I started it to talk to people about how to freeze your eggs. I mean, look, we should all know how to freeze our eggs the same way we all know you get your boobs done. I used to go into elevators and say, hey, do you know that you can freeze your eggs? And people would be like, huh, who are you? And now people know. So the word is out. But tonight, I'm going to go through the 8 steps that I think that are really important for you to know. Share it with your friends. Share it with your family members. Make sure people know. I want everyone to know this stuff because I certainly know it. My patients know it because they're my patients and I talk a lot and, I love talking about fertility and educating people. So sit down, tune in, and let's talk about these steps. Step 1 is before taking birth control pills or starting them, let's say in your 20s or any time in your life, whether it's birth control or an IUD, get your levels checked and have a carrier screen done. Why? How can this prevent infertility? Well, the thing is, when you take these types of medications or place the device in your uterus, you don't necessarily have naturally regular periods. They're basically artificially regular, and they can trick you into thinking you're trick you into thinking that you're fertile when you really might be running out of eggs at an early age. I want you to know about this. I want you to be proactive if it's happening to you, especially if, let's say, your mom had early menopause or your sister had problems, or if your mom went through fertility treatment. Super important to get them checked and do something about it, like try and start your family earlier, freeze your eggs, freeze embryos. That's why I want you to know about this stuff. As far as the carrier screen, the reason why I think that's important is because I don't want young people to find out the hard way. And what I mean by the hard way, I mean by having a clot that you might actually have a genetic predisposition to forming blood clots. That's what sometimes birth control pills can do. It's really rare, so don't be scared. But the tests nowadays are really relatively inexpensive. They used to be thousands of dollars, but getting a carrier screen done now is in the hundreds of dollars, and a lot of people have insurance coverage for these kinds of tests. So before you start birth control pills, get your AMH checked, maybe an FSH and estradiol, and have a carrier screen done to learn about your genetic predisposition to diseases, especially to clotting disorders. Step 2 to prevent infertility is to start CoQ10. CoQ10 can help the mitochondria in our cells. CoQ10 is something that naturally declines at age 30. Some studies suggest, really, really well done studies, that as our CoQ10 levels decline as a process of aging, it kind of coincides with when our fertility levels decline. So certainly I see patients who are older than, let's say, 39 even, and I strongly recommend CoQ10. But the one thing I wish that people knew is that potentially starting it even sooner and earlier could have some long-term benefits for your egg quality. So something to think about. There's no real known dose that's perfect. We don't really know. Is it 300? Is it 600? Is it 900? But what I recommend to patients is take something like this, about 1 to 2 capsules per day, and there's certainly other vitamins that have CoQ10 already in them, or pick something up from a local drugstore that has it. So you don't have to be super picky about what you're taking, but just taking something that you can tolerate easily. Step 3, if you are having heavy or painful periods, get a pelvic ultrasound done. I call it the pat, pat, rub, rub. You know what I'm talking about. You go to the doctor, you complain and you report, and I don't want to use the word complaining, but you're just reporting your symptoms. And you're saying, doctor, I have really painful periods. And they do a little pat, pat and a rub, rub, and they're like, oh, honey, you're fine. It's because you're a woman. No more, no longer. We won't accept that. So just say, pelvic ultrasound, please. Studies show that it can take women years, up to 6 years, to get an accurate diagnosis for endometriosis. Severe endometriosis, fibroids, these things can affect your fertility. Endometriosis can block tubes, it can make implantation rates lower, it can cause debilitating pain and affect your quality of life. And there are things you can do to prevent the progression of endometriosis. And so if you have it at a young age, it's something that you might want to know, because it might alter the things you do and choose to do to preserve your fertility. Like, you've heard me say it already on the show, freezing eggs, freezing embryos, starting your family earlier. It's just about that one saying you all know, that knowledge is power. So I don't want my patients to get pissed, and really pissed and aggravated by the fact that they went to doctors and no one listened to them. So if you find that no one's listening to you, find a doctor that will. There are so many awesome fertility doctors out there, incredible OBGYNs, that if you just tell them, I'd like a pelvic ultrasound because I'm having heavy and painful periods, I can't imagine that anyone would say no to that. And make sure that you keep a report inside your binder. You've heard me talking about this on these shows, about the importance of keeping track of your medical records. Have a fertility binder, have a medical binder, put everything in a certain section and track these things over time so that you're in control of your information and you're going to be your own best advocate. So step 4, understand your fertility health. Get your levels checked, whether it's at 21 because you're starting birth control pills, or 25 because you haven't done it before, whether you're on birth control pills or not. And then understand what it means for you. And not just get your levels checked. Talk to your family members. Learn about your family fertility history. The time to find out that your mom went through menopause at 40 is not when you're starting your family at 40. And I've seen this before. I've seen mothers go through menopause at 40. Their daughters come to me around the same age and wonder, why is this happening to me? And it's heartbreaking to see that those conversations just weren't happening. They're happening more and more, certainly, but I still see in certain families where women are just not talking openly and freely. Like, they know their sisters had problems getting pregnant, but no one really talks about it. But potentially that information could be fertility saving and sparing for someone else in that family. So certainly, if you've had a problem with fertility, if you have a sibling or family member, do perhaps share your story. Maybe there will be some learning that will come out of it. Maybe you'll spare them some of the heartache that you've gone through. So I put up this slide because eggwhisper.com is something I started out of Egg Freezing Party. And the reason why is people were coming to my egg freezing parties and I was saying, you know what I always say, get your levels checked. And they were saying they were going to their OBGYN and the OBGYN was saying, no, we can't do that for you. But times have changed. OBGYNs are totally on board and ready to help patients, especially in the San Francisco Bay Area. And I created eggwhisper.com just to help people out there who might not have access to a fertility doctor or an OBGYN. So certainly go to the website, let me know if you want your levels checked, and I can help you. So now, sperm freezing party. So that's step 5, check sperm health. Age of the sperm matters. So I don't think it's a bad idea for guys to freeze sperm, let's say in their 20s. It's certainly a lot easier to do than egg freezing. I mean, egg freezing involves shots and surgery, bloating, and there's always risks and complications. They're small, but it's not a party. Sperm freezing, it's a little easier. It's a cup, maybe some blood work, meaning infectious disease labs before you have it done, and then you can send the sperm to long-term storage and basically freeze it and forget it until you may need it. We know that all fertility issues that we see in fertility practices are not just egg related. You know, certainly women we're used to it. We're used to everything being our fault, but it just isn't. Not that we are going to blame anyone. But most cases of fertility that I see, but often point to issues on both sides, both female factors and male factors. And I can tell you, if I have a 50-year-old father in my office and he had sperm frozen when he was 25, I will pick that 25-year-old sperm any day. But the thing is, you wouldn't necessarily be able to do these things if you're older. So if you know someone, you have a family member, and you want to do something to prevent infertility and make it easy for you in the future in case you might need it, I highly recommend freezing sperm. So step 6 is avoid STDs. Chlamydia is bad. So I put this slide up because basically a water slide, right? I mean, you have to start at the top and get to the bottom and get to the pool. And that's basically what happens. So sperm gets to the top and then it travels down the fallopian tube and then lands in the uterus. And if that water slide is clogged or blocked, the sperm's not getting anywhere. The embryo's not traveling anywhere. You're at higher risk for ectopic pregnancy. So one exposure to chlamydia can increase your risk of needing something called IVF. So that's a procedure where you need to see someone like me. I know a lot of people watch this show already know what IVF is, but again, I'm trying to help you not be my patient. Well, I want you to be my patient if you need my help, but ultimately, I'm using this platform to educate you. I want you to avoid chlamydia. No dirty penises. Mom, are you watching? Okay, so step 7, I know, I say this all the time. Get your tushy checked. T is for tubes, U is for uterus, S is for sperm health, H is for hormones and preconception labs. Y is your genetics. So, why would you go through the process of getting your tushy checked if you want to prevent infertility? Well, the thing is, knowledge is power. Fertility knowledge is power. So if there was something that was wrong and you fixed it, then you wouldn't have to go through fertility treatments like a thyroid problem, like a polyp, like a cyst on your ovary that could be blocking a tube through endometriosis and due to endometriosis. So these are the things that I want you guys to know ahead of time. So step 8, plan your pregnancies, right? So we hear so much about secondary infertility now, and I'm so glad that there are a lot of celebrities talking about it. There was an announcement today from one famous TV show host saying how she had one baby and then had troubles getting pregnant with baby number 2. That's why it's so important to plan your pregnancies. Get your levels checked in between, freeze embryos or eggs in between if you need to, depending on what your family plans are. But if you don't, talk to a doctor, discuss the roadmap, have that all planned out ahead of time. You might have fertility regret. You might be upset that no one talked to you about these things ahead of time. So that's why I want to educate you about this. Thank you guys for watching tonight's show. I hope that no one has problems getting pregnant, obviously, but I know that inevitably it's just part of human biology to have issues. But certainly, I want there to be less heartbreak. I want you guys to know that you have a doctor here that's happy to listen to you and talk to you about your problems and hopefully make IVF more like is very fun than is very effed up. I'm slap happy tonight. I've been up since 5 in the morning, started my cases super early. So thank you for bearing with me. I hope you learned a lot from the show. I hope you, tune in next week too. I'll see you guys later. Good night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee,
And you have yet another success story.
Just launched by an East Bay Fertility